So one of the things I wanted to really highlight here is what happens. Like EoE is, you can't cure EoE, correct? It's a chronic condition. And the reason why I want to bring some light to this is what happens if EoE continues to go undiagnosed. It's a progressive disease. So give us a sense of what is happening in the esophagus and why it's so important to get evaluated sooner rather than later.
Yeah. So we have an allergen, right? It triggers an inflammatory response. If you keep having inflammation, eventually inflammation means recruitment of different types of cells in your body to that one specific area. So if you're persistently inflamed in one part of your esophagus, for example, and I'm really making this, from my standpoint, as simple as I can. You keep bringing these cells there, you keep bringing these cells there, you now have a collection of cells there. That results in scarring. All right. Persistent inflammatory cascade scarring. Scarring in your esophagus will eventually stiffen your esophagus or narrow your esophagus, leading to a stricture, which is a physical narrowing at the end of your esophagus. I often tell patients, whether it comes to different esophageal diseases, such as even Barrett's, if you keep scratching your hand or your palm, eventually you get a scab there, right? A scab forms. Now that scab, if you keep irritating that area, will get larger and larger. That's going to narrow the lumen or change the anatomy. And that's what's happening here. Now, we can go in there endoscopically and open that structure up. We can break it up. But the longer you wait, the harder it is to break that up and the more symptomatic you will be.
Yeah, and we just did this episode prior to speaking with you with the patient Samantha, and she goes through her journey and what happened to her esophagus, and it was literally that big. She shows us, and she shows us an allergy pill that she was taking, and that pill got stuck in her esophagus. It was mind-blowing.
Yeah. Yeah. And it's because it's subtle symptoms. We evolve, we adapt, but that opening getting smaller and smaller. It's more and more scarring, stricturing, narrowing.
So for those people that may be listening and maybe they have a loved one or maybe themselves, what can they expect during an evaluation? Like, what is an endoscopy and why are they so important? Not only for diagnosis, but as we get into the treatment, why that's so important.
Yeah, so an upper endoscopy is a test where we use a small camera to look at your esophagus in this case, right? Not only are we looking, we have the ability during the endoscopy to take samples of your esophagus. And looking is important, samples are important, but we also have the ability during the endoscopy of, remember we're talking about narrowing, opening that narrowing up, or what we call dilation of a stricture. So not only can it be diagnostic, it can also be therapeutic in endoscopy. The reason sampling is so important is that helps us most objectively determine how much eosinophilic inflammation is, or very simply, how many of these eosinophilic cells, these eosinophils have come to rescue or part of this allergen inflammatory cascade.